Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'll be sharing a recent initiative that I've been working on with some colleagues called the AARP Age-Friendly Social Innovation Challenge. This is a 10-part special series, and today we are going to wrap it up and talk about part 10, transportation. So this series is related to several regional events that we've held at GW, the Center for Aging, Health, and Humanities, with our 5 regional age-friendly partners. And if you missed the overview, you can check out part 1, which is episode 89, if you're looking for it on my website, melissabphd.com, or on my YouTube channel. In a nutshell, the mornings was spent doing a design thinking session, and participants were paired up by domains of interest. These domains are reflective of the World Health Organization and AARP's framework for age-friendly cities and municipalities. So when we think about transportation, it's more than just driving. It's all the different ways that we move around our communities. So this includes cars, but it also includes pedestrians, cyclists, and public transportation. An age-friendly city is going to have sidewalks and safe crosswalks for pedestrians. If you're in Fairfax City, you need to watch out for the drivers if you're walking. And dedicated bike lanes to help drivers and bikers, and public transportation options that include large-scale options such as trains, buses, and light rail, but also smaller transportation options such as taxis, shuttles, or rideshare services. So there are many issues related to transportation for older adults, and in order to focus the group's problem solving and their thinking, a scenario was designed by our design thinking team. From there, the group devised 5 different ideas for how to solve a problem, and then they chose one to develop into an innovative solution. The participants included university students from the DC metropolitan area, older adults, and local leaders who live in this region and work in the age-friendly space. So groups were free to come up with ideas based on what they felt like was the biggest priority for the subject of their scenario. And then they were instructed to think about solutions without concern for practicality, financing, or what policies would need to change in order to make their solutions a reality. That's easier said than done. As you listen, you may have ideas for a solution, or you might know about a program that would help older adults and their families facing similar transportation challenges. Please add your comments below this video, and now let's tune in to hear what they came up with.
Great, thank you. So we had a great group, and as I'm listening to this all afternoon, I keep hearing how transportation is sort of a component of pretty much everything. So we came to a lot of similar conclusions that I'm hearing throughout all of this. So our scenario was Sarah, who's 69 years young and lives in Alexandria, Virginia, with her husband who suffers from Parkinson's. She's his primary caregiver. She does a lot for him. She's lived in her neighborhood quite some time, has lots of good friends in the neighborhood, but they're all aging as she is, so aging in place. Her eyesight has been hard or failing, and so it's getting harder for her to do the things she needs to do, including driving. So she no longer drives. She doesn't feel safe on the streets with all the cars everywhere, and plus she's kind of undergoing a lot of stress for her husband. It's winter, it's getting dark early. She doesn't like to ask people for help, and she needs to get herself and her husband to doctor's appointments, and she feels like it's too much some days. So she does need help, but just doesn't know how to ask for it. So a lot going on here, really. So not only the transportation issues, but also the caring for her husband, maybe some depression, the need to connect socially to her community. So our main problem statement that, after discussing a few options, came to the consensus was that Sarah needs a way to get high quality, vetted, affordable, inclusive, relevant information, as well as supportive connections and services. So she needs to feel that she is provided and receiving information to manage her life, including getting to where she and her husband need to go, and also managing that caregiver responsibility. So where we determine the need really is in the information piece. And all the rest can maybe stem from there. So what we wanted to do is the best information system ever. And so a little bit of moonshot here, but it would provide high quality, vetted, affordable, inclusive, relevant information, as well as provide connections and services. So it's like a mobility management information database, person connected information program on transportation that can also link to other needs as well. So it would include all the resources in the region, all knowing everything at your fingertips, how it's connected, so that people don't feel lost, offering elder care, so other resources as well as the transportation. So how would it work? So it would be all the resources in the community, so new and existing transportation resources in the region. So it would be the biggest and best database with continuously vetted and updated information. So in our dream world, there are no problems with any of this. It would be easy to use. So we would want it to be web-based, app-based, and also have a call-in component. It would be well crafted. So it could be one click for people who are able to do that, but then also have a warm transfer where there could be a person who could go more in depth, maybe do some options counseling around transportation. And then also a warm transfer maybe to those actual providers. So either through the website or a phone. Our system would support diversity and inclusion. So it would be all users at their income need or at whatever income level, and support all the unique needs. So we know everybody's not the same, their needs may be different and may even be different for different transportation situations. So we would want the staff who manages this database and call center to be well trained, to know about the programs across the region and know what to do for the next steps. We talked about volunteers who might sign up, and we also talked about the villages as well. For transportation options for some of these people, which would help with that connection to the neighborhood that I think it was Sarah, had mentioned she kind of was missing in her life. We would want a good triage function so that say the person calls in and you're speaking on the phone to somebody, that they could kind of help identify maybe other issues. Not only just the transportation piece, and to really be able to identify the needs involved. It would include professional development and quarterly meetings among the staff, and also among the programs and the systems that operate them. So both on the county level, as well as cities and the actual staff managing the telephone calls. It would require cross-organization buy-in for all the regional organizations involved. It can process accounts for users and families. So it would have a payment component in there, and family could even put money in for a loved one. And so it would really require regional coordination. And then we talked about safety too as a concern. So service providers would have to be certified in some way, or maybe undergo some type of training to work with older adults and people with disabilities, and be vetted, the organizations providing the transportation.
So I would like to thank all of our participants in this group for their time, effort, and energy. As you can see, they identified a variety of problems and ideas for how to meet the needs that were embedded in the scenario. You can also check out episode 70 of this podcast to learn more about transportation options for older adults in a program called NV Rides. That can be found on my website at melissabphd.com. And the other podcast that I have related to transportation right now is just around episode 63 is titled Alzheimer's Disease and Driving, and 5 Signs That It's Time to Take the Keys. So you may have another idea for a solution or identify a transportation problem or a program that could solve one. And please add your comments below this video or on my website where the episode can be found. I would love to hear from you. Thanks for tuning in for this special 10-part series. It was a long 10 weeks. And as you can see, I changed my office setting and I'm still figuring things out, but I had to get these finished. So that's how it goes. Might not be perfect, but you get the point. See you next time when I'm going to be talking about something else. Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities.